Now, if you have problems with your upper leg, okay, I'm going to show you how to put the pads and where to put the pads for each muscle group. So if you have a problem with the hamstring group, so you just put one pad on the lower portion of the hamstring, and then one just in the belly, okay, of the hamstring muscle, just like that, all right? And you just simply turn it on. Now, you want to make sure the muscle is nice and loose while you're treating it, all right? So you don't want to be tensing it up. Okay, just like that, you want to let it contract and relax so that it can go through its workout cycles, and then the blood will circulate better, the nerve will circulate better, and then the muscle will start to heal on itself. Now, if you have sciatic pain going down your legs, okay, this is one area you can use that, but the other area that's crucial is right here in the buttock area. So you want one pad here, and then the other pad, in the location where you're having pain or numbness. So I'm going to talk more about sciatic pain in treatment of low back and sciatic section of the DVD. Now, if you have, let me turn it off, pain on this side here, what we call iliotibial band syndrome. This is what you do, all right? You put one pad on the side of the thigh, and the second pad, there's two locations, okay? One is you put it just in front of your hip here, and then another one just to the back of the hip. What the objective here is to basically relieve the pain, where the tibial band is. That's one sheath that runs here. And the other objective is to normalize the tone of those muscles that's controlling that iliotibial band. So we're going to control the hip flexors and control the hip extensor muscle. So by putting it here, we're going to relax the hip flexors. By putting behind the hip, we're going to relax the hip extensors, so that if those muscles pull properly, then this iliotibial band will work better, and then you can have less pain. Now, if you have pain right where the iliotibial band connects to the knee area, then what you do is put one pad over that area and the other one in the middle of the iliotibial band. This is very important for those of you who do a lot of sports, especially running sports, sprinting sports. Okay, those areas can be troublesome. Okay, next area. If you have hurt your quadriceps, okay, that's the four muscles that make up the front of your thigh. So basically, again, whichever muscle you feel is giving you a problem, you just put the pads over it, and it's very simple. The key is make sure your legs nice and relaxed. So you probably should be just sitting down, letting your legs hang loose, and then let the machine, stimulate the nerve and muscle to restore normal motion and normal function back in those muscles. What the machine does, it basically relaxes the muscle. So if they're too tense, which is usually the case, it will help to relax it. It also helps to tone the muscle, meaning if the muscle fibers are too loose, it helps to bring it back its normal tonicity, okay? So it can do both because it normalizes the nerve and muscle function. Now, the other thing it does, it helps to stimulate the nerve and blood circulation. And if the blood and nerve is circulating better, you're going to get better, better and faster pain relief, but more importantly, faster tissue repair. So we basically are trying to help the body to heal itself faster, and that's the key here. Now, some of you may be getting what we call patellofemoral joint syndrome, meaning you get pain behind the kneecap, okay? It's not the ligaments, it's actually behind the kneecap. And that can be caused by imbalances of the muscle that control, okay, your leg movement. So if that's the case, I would treat the knee. So go to the section where, I teach you how to treat knees. But I would also treat the muscle of the quadricep, especially this muscle here, what we call the vastus medialis muscle. So we put one pad there, okay, as one, as part of the treatment, and then we stimulate, because we want to make sure the tone of this group and this group are normal, okay? If we do that, then the kneecap will stay in better alignment because you're pulling on it evenly. It's like different cables. If one cable is too tight, then the alignment is going to be off. But if both cables are equally, have equal tension, then the kneecap's going to track better, within the knee joint. So that's going to make it work better. So for the vastus medialis, and then the other group on the outside. So in the fancy name for this muscle group is the vastus lateralis. Okay. So basically, this is what we do. All right. Time-wise, usually I keep the treatment around 20-30 minutes because that's the time you need to help to see and measure a big difference in improvement. And repetition Anything from 3 to 5 times a day or as you need it is fine. Again, don't worry about overusing. Now, another muscle group that often causes people problem is the adductor group, okay, the muscle inside your thigh. So this one, okay, you basically put it close to the groin line, okay, right here, that's close to the attachment, is where they usually have the problem. And the other one just a little bit further down. Make sure the pads are not touching. If anytime the pads are touching, the machine, you're not going to feel stimulation because the electrical pulse will go through the pads instead of your body. Okay? Again, just turn up to a point where you actually get contraction. Just as a reminder, always let that muscle that you're treating be nice and relaxed. Let the machine do the work. Don't fight it, okay? Just let it do its own work, and then it's going to heal much better, just like that. Okay? And that's it, okay? Best wish to your injuries, and hope you heal very fast. Let me show you a series of exercises for your hip-related problems. Now, find yourself a good chair, okay, to support yourself, or anything that can support yourself, and just swing your hips back and forth like a pendulum, okay? Don't need any force, just gently swing that hip. You just want that joint to go back and forth. Again, motion is lotion. You want to lubricate that hip joint. So this is very good for anybody with arthritic changes in the hip joint. Or if you got tight muscle in your hip joint, that will help to loosen them too. So do this as often as you can throughout the day. And after a few months, you'll see a big difference with your joint pain. Now, I'm going to show you some stretching as well. So again, find yourself a good chair to support with. Stand with the bad leg towards the chair. Put the bad leg behind you. And support the weight with your hand and go down gently. And you should feel the stretching on the side of your hip, just like that. Okay? Now, to stretch the groin muscles, I point my toes forward, front, okay, and back foot, and I just go down. Just go straight down and just a little bit forward, keeping my back straight or slightly extended, and just leaning forward, and you should feel the pulling in the front. Now, if you want more stretch, you just have a longer stride, just like that, okay? And to stretch the adductors, I turn my foot sideways, and doing the same motion, I just go down slowly, supporting the weight with your hand, so you can control how much stretching you're going to have. So this, turn the foot out, I'm stretching the adductors. I turn my foot forward, again, like a fencer stand, all right? Just gently go down and slightly forward. So you feel some stretching here and in the front. Okay, so those are good stretching for your hip. Now, to work on any tight muscles that you might have inside the hip area, the gluteus muscle, the piriformis muscle, you just lie on your back, okay? Now, this is a two-step process. First, you lift your hip up till it's making a straight line with your back. And then you push your feet away from your buttock. So my feet is going away from me. And that's the action. Now, some of you may find it easier to be pushing against the wall or something that don't give. And if you do it right, you can feel the buttock muscle really tense. But the hamstring muscle at the back of the leg here, that stays nice and loose. If you just feel tension in the back of your leg, then that's not correct. You want to feel the tension here. This is the muscle you're working on. And the hamstring, stay nice and loose. So push away from you, contract for 10 seconds, and relax. Okay? So lift up, push away. Push, 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 push for 10 seconds. Again, this is tense, this is loose. And relax. And repeat that 10 times. And then do that a couple times a day. That'll help you a lot.